Hi, Seth Bilazarian. I'd like to update on a recent article in the Journal of American College of Cardiology, a very interesting article entitled Low-Risk Diet and Lifestyle Habits in the Primary Prevention of Myocardial Infarction. Sounds like a mouthful, but basically what can you do in terms of what you're doing in your life, your diet, as a man to prevent a heart attack? That's basically what this article is about. And what they have estimated is there are 5 combined behaviors, things that you can do that incrementally or stepwise reduce your risk. You do some of these, you reduce some of your risk. You do all of these, you almost eliminate your risk of a heart attack as a man. A lot of this pertains to women, but the paper refers to men. But let me just go through them one by one. The risk factors that were described are maintaining a healthy body weight. And that's something called the body mass index. Ideally, we try to keep our body mass index less than 25. That's easy to find on the internet. You can put your height in. You put your height in and you put in your, get your result of your weight with height and weight. You get body mass index, and a number of 25 is the goal for ideal body weight. That reduces your risk from 80% down to 64% if you just do that. So it takes off about 15% of your risk for a heart attack if you maintain an ideal body weight. The next thing is physical activity. 3 times a week aerobic exercise, totaling 150 minutes per week is the recommendation. So you can do that any way you like. 3 times a week, 50 minutes. 5 times a week, take a walk for 30 minutes. Any kind of strategy of 150 minutes of aerobic exercise per week, that would satisfy that. And that takes you from 64% down to 44%. That's a 20% cut in your heart attack risk. The next is smoking. Reduces you from 44 to 23% if you don't smoke. Of course, if you don't smoke, don't start. But if you do smoke, quitting that reduces it almost more than 20%, 21% reduction in heart attack risk. And then one of the easier ones to do is alcohol in moderation. Having a drink per day actually is beneficial. It actually reduces the chance of a heart attack if you have 1 drink a day as a man. And when I say 1 drink a day, that's 1 12-ounce beer, 1 8-ounce glass of wine, or 1.5 ounces of liquor. That's not a bigger amount. 1 drink is what is considered alcohol in moderation. And that reduces you from 23% down to 16%, another 7% risk. And then the final thing is a healthy diet, and that's recommended to be a Mediterranean-style diet. Just switching from a diet rich in processed foods or sugars or a non-Mediterranean-style diet to a Mediterranean-style diet, which is enriched with fresh fruits and vegetables, grains, and fish. That will reduce your risk from 16% down to 0, about a 16%. You can do some of these, but doing all of them has a really dramatic benefit. And it's not just heart attack. This article was written about heart attack, but these behaviors have also been shown to reduce the risk of other older age risks, such as cancer or other degenerative diseases such as diabetes. So make these changes, make some of them, make all of them, or even make part of them. If you don't exercise fully as 150 minutes, doing some exercise is better than doing none at all. So consider this, check out the article, and talk with your doctor about strategies to initiate these healthy lifestyles. Thanks until next time.